the model for Cardiff as a healthy city, and this is one thing which is probably easier to look at than it is to explain. But I guess at the centre of the model are the people of Cardiff. They must be in sort of any service that you deliver. They've got to be at the centre. But certainly when you're talking about people's health and well-being, they're the people. They're slap bang in the middle. Sitting underneath that, you have, I guess, what you could call the sort of the capacity building, the people that will help to drive forward this healthy cities agenda. Now, they're community organisations, they're neighbourhoods themselves, they're communities across the city, businesses, and of course us here in local government. And they're sort of pushing up the agenda. Overarching, if you will, the sort of big strategic thing is the European network of healthy cities itself. That's so across Europe. That's where best practice is discussed. That's where people can really blaze a trail in innovative ways of sort of encouraging a healthier way of living. Then that feeds down into the Cardiff Healthy City programme, which we've discussed briefly now. Then feeding further down from there, it's all about trying to drive forward an agenda of health and health equality in all of the local policies. As I was saying, this is not an issue just for adult services. It's not an issue just for children's services. It's an issue for the whole council. And we've also got what is called in a rather highfalutin way, a healthy urban design. What does that mean? Well, going forward, one of the biggest issues on the agenda in Cardiff at the moment is the local development plan and building Cardiff for the future. And any sensible local development plan should take into account how the city will grow, the accesses that the services that people in these new parts of the city will need to access. And a city which is developed often on an ad hoc basis over many hundreds of years, a sensible local development plan can actually pause, take a breath, and really try to build in the services and facilities that are needed to tackle some of the most deep-rooted health inequalities.